Welcome back. Under the hormonal methods of contraception, in the part 1 of the video, we have studied about the classification. Under the classification, we dealt about the oral pills and we have the depot formulations which we'll be dealing now in this video. The mechanism of action of OCPs is done, the adverse effects, will deal about the contraindications and the non-contraceptive benefits of OCPs and depot formulations as well. The classification, oral pills and depot formulations, combined pills, progestogen only pills, post-coital pills, once a month pill, male pill. Gossipol is already done. Now we'll be dealing about the depot formulations under which we have injectables. Injectables, progestogens only, subdermal implants and vaginal rings. All this is done. Now we'll start with the contraindications. So we completed the adverse effects. Let's start the contraindications of OCPs. What are the conditions wherein the OCPs is not recommended? It is contraindicated. Absolute contraindications, and we have certain special problems requiring the surveillance and wherein the contraceptive is not encouraged. The suspected pregnancy. In case the pregnancy is suspected, then the OCP should not be given. Then we have history of thromboembolism, deep vein thrombosis in a woman, cardiac abnormalities. So we see the cardiac abnormalities if she has a previous myocardial infarction, history of stroke or hypertension, dyslipidemias, atherosclerosis. So we have the cardiovascular conditions, abnormalities, abnormal vaginal bleeding, breast cancer, genital cancers. So we see that under the cancers we have breast cancer, genital cancers, that is cervical cancers, and we have the renal diseases, liver diseases, congenital hyperlipidemia, also epilepsy, wherein it is a contraindication. The hormonal contraceptives should not be considered in cases of epilepsy. Lactating mother. So we see that lactation, the preparations which are containing the high amount of estrogens, they will adversely affect the quantity as well as the constituents of the breast milk. So they are saying that lactating mother is a contraindication. Why? It is because it is adversely affecting the quantity as well as the constituents of the breast milk. It will also cause the premature stoppage of secretion of breast milk. Hormone excretion occurs in cases of breast milk. So the baby will get high amounts or altered amounts of hormones in the body. It is because the breast milk will contain the hormones in it which will be delivered from the mother vertically into the baby. So these were the contraindications, guys. The suspected pregnancies. Under heart we have cardiac abnormalities, renal, liver diseases, abnormal vaginal bleeding, cancers, genital cancers, breast cancers, hyperlipidemia, epilepsy, lactating mother. And why in the lactating mother? It alters the constituents, reduces the quantity, causes premature stoppage, and hormone will excrete from the breast milk into the baby. So let us compare the adverse effects and contraindications and try to remember it. In cases of thromboembolism, it is contraindicated because like in leg vein thrombosis or deep vein thrombosis and thromboembolism, it is a contraindication. Cardiac abnormalities like myocardial infarction, because it can enhance the disease and can also result in further abnormalities. Cardiac abnormalities, OCPs can result myocardial infarction, so it is contraindicated. Abnormal vaginal bleeding, so this OCPs can result in bleeding disturbances. It can be an adverse effect of OCP, not recommended. Breast cancer and genital cancers, renal diseases in cases of increased BP and blood sugar. Liver diseases, we have hepatocellular adenoma. We said that in the use of the pill may lead to hepatocellular adenoma and gallbladder diseases under the adverse effects. So remember, liver diseases under the adverse effects, you can remember hepatocellular adenoma. In congenital hyperlipidemia, adverse effect is dyslipidemia. Epilepsy, headache, migraine. Lactating mother, it can cause the premature cessation of lactation. By this comparison, you can remember the adverse effects as well as contraindication. What are all the adverse effects and what are the conditions wherein it is contraindicated? I hope it is clear. Under the cervical cancers, bleeding, cardiac abnormalities, liver renal abnormalities, epilepsy and lactating mother, it is contraindicated. What are the adverse effects? What all the OCPs can lead to? It can lead to cancers, bleeding disturbances, myocardial infarction, migraine, headache, dyslipidemia and premature cessation of lactation. So we are very well thorough about the contraindications and adverse effects. Now let us see what are the benefits. Apart from the spacing, apart from the prevention of pregnancy, what are all the non-contraceptive benefit? It can be given a protection against the benign breast disorders. What does the OCPs do? They will provide us a protection. The beneficial effect, the significant benefit of the pill is that in the first place, 100% effectiveness in preventing the pregnancy. Thereby what happens if the woman is having 100% surety that the conception is not gonna occur, so it will remove the anxiety in the woman about the unplanned pregnancy, the all of the anxiety, worry and because lots of anxiety can lead to many other problems. So the anxiety is removed in the women about the risk of the unplanned pregnancy. And apart from that, we also see that it has been protective in cases of benign breast disorders like fibrocystic diseases, fibroadenomas, ovarian cyst and dysmenorrhea, irregular menstrual cycles. So in cases of dysmenorrheas, irregular menstrual cycles, pelvic inflammatory diseases, dysfunctional uterine bleeding, DUB, pelvic inflammatory diseases, all of these chapters we have dealt in OBG, and also the respective videos are available in the playlist. And then we have adenomyosis, iron deficiency, anemia, endometriosis. So you can see the picture here. The endometriosis, the endometrium being lodged in different locations in the reproductive tract, and thereby the bleeding occurs from those sites. Endometriosis. Then we have ectopic pregnancy, polycystic ovarian syndrome. In all these conditions, it can provide as a protection. So remember, don't write them under the adverse effects. We have already dealt. Now these are the non-contraceptive benefits. What are we discussing about? The non-contraceptive benefit of OCP. It is preventing or giving a protection against all these diseases. Also used in the treatment of all these diseases in certain conditions. So we see that it is used in dysmenorrhea, provides protection against irregular menstrual cycles, PID, DUB, adenomyosis, endometriosis, iron deficiency, anemia, ectopic pregnancy, PCOS, colorectal malignancies. So we see also in colorectal malignancies, endometrial cancers, ovarian cysts and cancers, the malignant ovarian diseases, it provides a protection. In cases of ovarian cancer, it has a significant benefit in giving a protection against the ovarian cancers. Moving on to a very important thing, that is Centroman, popularly the brand name Saheli. Centroman is a non-hormonal contraceptive. It is synthetic non-steroidal oral contraceptives. It is a synthetic non-steroidal OCP. The brand name Saheli, now Chaya program has been started by the government in 2018. The brand name is Saheli, popular brand name is Saheli, and this is a oral contraceptive pill in India, popular brand name Saheli, and now under the program Chaya. It has 30 mg of methoxychroman hydrochloride. The chemical is ormoloxifin. The mechanism of action, it has selective estrogen receptor modulators. SCRMS, a class of medication which acts on the estrogen receptors. This centroman has been developed by the Central Drug Research Institutes of Lucknow, India. Very important, you have to remember the dosage. One tablet, that is 30 mg, is given twice a week for 3 months, followed by one tablet per week until it is required. So guys, it is by the Central Drug Research Institute, Lucknow, India. The thing you have to remember is importantly this: Saheli has to be taken one tablet of 30 mcg twice a week. Okay, in 1 week they have to take, in 1 week they have to take 2 tablets. Okay, 1 week they have to take 2 tablets for a period of 3 months, followed by only one tablet a week until they require the contraception. Failure rate is 1.83 to 2.84 per women year. Okay, per 100 women year, what is the failure rate? It is 1.83 to 2.84. Okay, that is 83 and 84, 1 and 2. Okay, 1.83, 2.84, plus 1, here also plus 1 are the failure rates per 100 women year. Also, it is known as once a week pill, since just for the period of 3 months it is taken 2 pills per week. Later on, just one pill is taken for a week, so it is popularly known as once a week pill or Saheli. Only anti-implantation agent which is approved by clinically used globally. So we see that this is approved by clinical use globally, and it is effective as an anti-breast cancer agent. So we saw that all these OCPs will provide a protection against the breast cancers, cervical cancers, colorectal carcinomas. So we see that it is effective as an anti-breast. Popularly, it prevents the breast cancer. Contraindications is P, L square, H square. So we see that P for PCOD. When is it contraindicated? It is contraindicated in PCOD. L square, that is lactation and liver diseases. Then H square, hypersensitivity, and in cases of cervical hyperplasia. In such conditions, it is contraindicated. Saheli is contraindicated. What is the non-contraceptive benefit of Saheli? It is used in the treatment of dysfunctional uterine bleeding. So now let us summarize Saheli Centroman. Centroman, it is a non-hormonal contraceptive. It was brand name is Saheli under the Chaya program. It has been included in the year 2018. It is developed by the Central Drug Research Institute. What is the action? It has a estrogen receptor modulators, and very important, 2 tablets per week for a period of 3 months, followed by one tablet 1 week until they require the contraception. And we saw that it is anti-implantation agent. It prevents the implantation to occur. So it's not acting on the fertilization, it is preventing the implantation of the zygote in the uterus. The main action is it has some certain receptor modulators. By acting on them, here it is preventing the implantation of the zygote in the uterus. The contraindications we saw lactation, and L square, P is PCOD, and then L square lactation, liver diseases. H square is hypersensitivity and hyperplasia of the cervical area. And the non-contraceptive benefit is DUB, treatment of DUB. Moving on, Femilon or Elogon. Femilon is a new low dose OCP. So now this Femilon and all will be dealing because of pre-PG preparation. The underlined questions have been asked in the previous question papers. Now we see that low dose OCP? Which is a new low dose OCP? It is asked in the previous paper. New low dose OCP is Femilon or Elogen. Femilon or Elogen is a new low dose OCP. Ethinyl estradiol in cases of Femilon is 0.02 mg. Desogestrel is 0.15 mg. So ethinyl estradiol is nothing but estrogen and desogestrel is 0.15 mg. In combined OCP, estrogen will adversely affect the quantity and constituents of the breast milk, and it also causes the premature cessation of lactation, which we have repeated multiple times. By now you are very well aware that what does the OCP do? It will alter the quantity, it will alter the constituent of the breast milk. Secondly, it will cause the premature cessation of the breast milk. Remember, new low dose OCP is what, guys? Femilon or Elogen. Moving on to Femcon. Now let us see the picture. Femilon. Okay, there is a butterfly on the Femilon. This is Femilon. It is a new low dose low dose. Okay, low dose is what you have to remember. Moving on to the next OCP, that is Femcon ferrous tablets, Femcon Fe tablets, iron tablets also it contains. So Femcon is a chewable flavored OCP. Ethinyl estradiol is 35 mcg and norethindrone is 0.4 mg. We didn't find any question on this, but we can't say anything can come up. So remember, Femcon, it is a new chewable flavored OCP. Chewable flavored, just like gums, you can eat them. They are not like tablets, like those chewing gums, and you can just take them like a chewable flavored OCP, which contains ethinyl estradiol 35 mcg and norethindrone 0.4 mg. You can see this Femcon Fe tablets, chewable. Okay, moving on to the second classification, second half of the classification. So let us go to the previous page and use it and revise the thing what we have studied so far. So we are studying about the hormonal contraceptives. Under hormonal, we studied about the oral pills and depot formulations. Oral pills, we had 5 subheadings which we completed. Now we are going to the depot formulations. Under depot, we had 3 main headings. Those are injectables, subcutaneous implants and vaginal rings. Starting with injectables. Injectables, we have progestogen only. Under progestogen only depot formulation, we have DMPA and NET-EN. So guys, depot formulations, what do we understand by this? The need for the depot formulation, which are these depot formulations which are highly effective, they are reversible, the long acting, and they are also estrogen free. They are used for spacing the pregnancies in which a single administration of a depot will suffice for the several months or years, and the women need not stress. Okay. We have the injectable contraceptives, implants, vaginal rings, which will fall under this category. Remember guys, what was the main idea for the introduction of these depot formulations? We had OCPs, right? Lots of OCPs, various types, like chewable and so many things we saw. Now, what was the need for the depot formulation, which is a slow release of the hormone which takes place in the body, wherein we have injections, where we have the rings and implants? Why all these? It is because the OCPs had to be taken on daily basis or weekly basis, whereas these are very long acting. They are very effective. They are estrogen free. The women need not stress about taking the OCP every day. In case she forgets it, she need not be so stressed about conceiving. So we see that the depot formulations, which are slow releasing hormones in the body, which are in the form of injections, the injectables could be progestogens only depot formulation, and we have under that progestogens only DMPA and NET-EN. DMPA, what does DMPA stands for? It is depot medroxyprogesterone acetate, Depo-Provera. It is also known as Depo-Provera. Depot what guys? DMPA stands for DMPA. Depot medroxy progesterone acetate. It contains 150 mg of progesterone, and 1 it is given intramuscularly every 3 months. So we see that the standard dose is a intramuscular injection of 150 mg every 3 months. IM every 3 months. The standard dose is 150 mg. It gives the protection from the pregnancy in 99% of the women at least for 3 months. Just one injection. Imagine OCPs are taken daily. Here one injection. The standard dose which is given IM, it is preventing the pregnancy for the period of 3 months. It has a contraceptive effect in suppressing the ovulation. What does that DMPA do? It suppresses the ovulation. DMPA is found to be safe, effective and acceptable contraceptives because least minimum motivation is required, or no motivation at all is required. Just one injection and there's a contraceptive effect for 3 months. The advantage is that it also does not affect the lactation, the major advantage. Whereas in OCPs we saw that it will alter the constituents, the quantity, and it will stop the premature stoppage was seen, premature cessation could be seen. Whereas in cases of DMPA, the advantage is that it does not affect the lactation. It is acceptable during the postpartum periods to prevent the pregnancies. Now we see that for the females above 35 years it is recommended. Moving on to norethistron enantate. So norethistron enantate, or EN, norethistron enantate. How do we remember? NET EN, non-ethistron enantate. Okay, norethistron enantate. Cool. 200 mg. What is the standard dose? The standard dose is non-ethistron enantate has been in use as a contraceptive since 1996. This has been used. It is given intramuscularly. What is the dose? 200 mg every 60 days. So once in 60 days, the period of 2 months, one injection given for gives a contraceptive effect for 2 months. It includes the inhibition of ovulation. What is the action of NET-EN? It will inhibit the ovulation. It has progestogenic effects on the mucus. So it will cause the thickened mucosa, scanty cervical mucus. As a result, the sperm penetration doesn't occur. Next, the initially injection should be given during the first 5 days of menstrual period. Initial injection is given during the first 5 days of menstrual period. Adverse effect, disruption of the normal menstrual cycle. Menstrual cycles disruption can occur. What are the contraindications in cases of this DMPA and NET-EN? They are suspected pregnancies, abnormal vaginal bleeding, high BP, DVT, cervical carcinomas. So all of these we have seen. Suspected pregnancy, abnormal vaginal bleeding, high blood pressure, DVT and cancers. We have already dealt about it. Guys, also remember DMPA NET-EN, and the other thing is DMPA SC, which is a new low dose formulation of DMPA. Just like how we saw the new low dose of estrogen. If they ask new low dose of depot formulation, we have DMPA SC. Okay, DMPA SC depot sub-Q Provera. Okay, it is a sub-Q. It is injected under the skin rather than the muscle. Also, there is a difference. What is the difference between DMPA, just DMPA and DMPA SC? DMPA SC is injected under the skin. It also contains 104 mg of DMPA rather than 150. It is slightly less, 150, and here 104. Which 150 is given intramuscularly, whereas DMPA SC will be given in the skin. So now let us move on to the combined contraceptive, injectable contraceptives. The injectables will contain progestogen and estrogen both. Okay, it contains both progestogen and estrogen. They are given at the monthly intervals. And the combined injectable contraceptives, main thing, they will suppress the ovulation. The estrogenic effect, ovulation it will affect, whereas the progestogen effect, it will alter the cervical mucus, and it will make it thick and scanty. As a result, the sperm cannot penetrate. Changes are also produced in the endometrium. It makes the endometrium unfavorable for implantation. Even if the fertilization will occur, it is unlikely that the conception can occur, because the endometrium itself is unfavorable. It will not allow the zygote to implant on it, and the growth is not favorable. We have cyclophem, cycloprovera, mesigna. They have to be found in highly effective. So we see that cyclophem, cycloprovera and mesigna. They contain progesterone and estrogen. They are given at monthly intervals. The failure rates in cases of cyclophem and cycloprovera is 0.2, and in cases of mesigna it is 0.4. So you can see here the mesigna, cyclophemina, mesigna, okay, and Depots subcuprovera, okay, Depots SC we saw, right, that it's given here in the picture. Now Depot subcuprovera 104, which is a subcutaneous DMPA, 30% lower dose. It contains 104 mg. We have already dealt about this. Now, Risug, RISUG, it is a non-hormonal injectable. Risug is a non-hormonal injectable. In cases of Risug, remember styrene molic anhydride. What is the content? Styrene molic anhydride is seen. It destroys the sperms. It causes the partial blockage of vas deferens. It is interfering in the transport. Risug is mainly concerned with interfering the transport of the sperm via the vas deferens. It causes the blockage. It acts on the calcium channels which is required for transport, and it is causing the blockage of the vas deferens and destroys the sperm therein. It is a non-hormonal injectable. Antara program MPA, which contains 150 mg, which is given IM intramuscularly every 3 months. Okay, so we are clear with the combined thing. Moving on to, what do we have now? Subdermal implants. The subdermal implants, known as Norplant, for a long-term contraception. The Norplant and Norplant R2, they are the long-term contraceptives. It contains 6 silicone rubber capsules which are containing 35 mg each of levonorgestrel. So we can see here the Norplant. How many are there? 6. Okay. Let's see if you can appreciate in the picture. 1 2 3 4 5 6. Okay, so we have 6 silicone rubber capsules. You can see how they are available in the sheet. So this subdermal implant, it will contain 6 silastic or silicone rubber capsules which will contain 35 mg of levonorgestrel. The most recent device is comprising a fabrication of this levonorgestrel into 2 small rods. Instead of the 6, they made it into just, so we had 1 2 3 4 5 6 rods, okay, which contained how much? 35 mg of levonorgestrel. Now they bought a fabrication in that, wherein the levonorgestrel, 2 small rods of levonorgestrel. How many rods are there here? Just 2 rods of levonorgestrel were got. So they named it Norplant R2, which was comparatively easier to insert and remove. And also the silastilic capsules, or the rods, which are implanted beneath the skin of the forearm or the upper arm. So we see that it is inserted in the skin of the forearm or in the upper arm. The lifespan of this contraceptive is over a period of 5 years. Effective contraception is provided for over, guys, 5 years. The contraceptive effect of Norplant is reversible on the removal of these capsules. Once these capsules are removed, the contraceptive effect is reversible. The main disadvantage is it causes the irregularities of the menstrual bleeding, and also the surgical procedures are necessary to insert and remove the implants. So just to insert and remove these implants, a small surgical procedure is required to insert them, to remove them timely, but it is providing a contraceptive effect for a period of 5 years. Moving on to the vaginal rings. And the last part, before that, let us deal about implanon, nexplanon, metered dose transdermal systems, and contraceptive patches. So, implanon. Implanon is a subdermal implant. Just now we're dealing about the subdermal implants. Remember, implanon is also a subdermal implant. It is a single semi-rigid rod. Now we saw Norplant contains 6 silicon rubber rods. Here the Norplant R2, which was slightly fabricated, and it was just containing 2 capsules or rods, whereas implanon contains only one single rod. Implanon 1 30 to 40 mcg etonogestrel per day is released, and it blocks the hypothalamus, thereby it blocks the pituitary axis and inhibits the ovulation. So we know that hypothalamus stimulates the pituitary axis, which further releases FSH and LH, which acts on the ovaries, thereby the ovulation occurs. Now it directly blocks the hypothalamus, thereby the further process is also inhibited. Lifespan of implanon is 3 years. It is a non-radio opaque. So the UG level, guys, remember, for the UG level, Norplant and Norplant R2 is important. Norplant 6 rods is there. In Norplant R2 there are 2 rods, and the content you have to remember, in cases of 6 Norplant R2 only Norplant 35 mg of levonorgestrel was seen, whereas in cases of Norplant R2 we saw that 75 mg in each. Okay, the difference and these two is what you have to remember at the UG level. Now at the higher level, you also can know about nexplanon, which is similar to implanon in all the aspects, like it is a single rod. 30 to 40 mcg of etonogestrel is released per day, except that it is radio opaque. It is non-radio opaque. Nexplanon, see, implanon, nexplanon. Implanon is non-radioactive. Nexplanon is radioactive. Metered dose transdermal system. They are Nestoron sprayed on the forearm of the females. It is effective in cases of the lactating females. It is this Nestoron or metered dose transdermal system. You can see here. Nexplanon, we get it. It is a radio opaque thing, contraceptive, wherein it is just sprayed on the forearm of the women, and it is females. It is effective in cases of the lactating females. It does not alter the constituent or the volume of the lactation or the milk. So we see that it is used in cases of lactating females. Moving on to the contraceptive patches, you can see here the various patches. The contraceptive patches, the transdermal patches, which will release the synthetic estrogen and progesterone hormones, and thereby it will prevent the pregnancy. So these patches will release estrogen and progesterone hormones, and thereby they prevent the pregnancy. One patch is applied for 7 days. 3 such patches are applied successively. No such patch is applied in the 4th week. So we see that one patch for 7 days. Second, 3 patches are applied in the so we see that first patch 1 week, 1 patch. Next 3 weeks, 1 1 1. The 4th week, no patch is applied. Moving on to the last part, that is the vaginal rings. The vaginal rings contain levonorgestrel. They have found to be very effective. The levonorgestrel, we see that it is this hormone levonorgestrel will be slowly absorbed through the vaginal mucosa. This ring is being inserted like this. So we have the vaginal ring which is inserted, and it is covering the mouth of the cervix, and we have the vaginal ring. What does the vaginal ring do? This hormone, it releases the hormone levonorgestrel. This levonorgestrel hormone will be slowly absorbed through the vaginal mucosa. it is permitting most of it to bypass the digestive system and enters the liver, and allowing a potentially lower dose. This ring will act as a very good contraceptive. The ring is worn in the vagina for 3 weeks of the cycle, and it will be removed in the 4th week. So we see that it is worn in the vagina for 3 weeks of the cycle, and it will be removed for the 4th week. Combined hormonal contraceptive vaginal ring. We also have a combined hormonal contraceptive vaginal ring. We have etonogestrel, a progesterone, and ethinyl estradiol. So we have a progestogen and estrogen component combined together, which will prevent the ovulation. Nuvaring, okay, the brand name Nuvaring, combined hormonal contraceptive vaginal ring. Nuvaring, etonogestrel, a progestin, and ethinyl estradiol is what it contains. Thank you. With this, we complete the hormonal contraceptives. So, before completing the video, let us just have a quick recap about the pre-PG questions. The underlined questions are our pre-PG questions. We remember the low dose. So, DMPA is given for every 3 months. So, we see that DMPA is 150 mg. Let us revise again. DMPA, and we have DMPA SC, right? So DMPA, it is 150 mg intramuscularly, whereas this is 104 I. It's not given intramuscularly. In fact, it is given under the skin. This was the difference, and it is given every 3 months. Okay, now the other questions. The new low dose OCP. What was the new low dose OCP? It is Femilon or Elogen. It contains ethinyl estradiol 0.02 mg. Then what is the failure rate of Saheli? It is 1.83 to 2.84. I also told you how to remember it. 1 and 2. How are you going to select the options? 83, 84. So the failure rate is 1.83 to 2.84 per 100 women years. Sorry. Okay. Moving on. Next we have the non-contraceptive benefits. If they mention benign breast disorders, dysmenorrhea, PID, iron deficiency anemia, all of the above. Tick all of the above. It also prevents against ectopic pregnancy, colorectal malignancy, ovarian cyst and cancer. So we should be very well aware about the non-contraceptive benefits. And the contraindications: thromboembolism, cardiac abnormalities, breast cancer, renal diseases, liver diseases, hyperlipidemia, lactating mother. And the adverse effects we have already dealt. Then the adverse effects: weight gain, breast tenderness, headache, bleeding disturbances. In cases of cancer, hepatocellular adenoma. Remember guys, if they give the options and hepatocellular adenoma is there, do not confuse. It is all of the above. The hepatocellular adenoma is also an adverse effect of OCP. We have the combined oral pills, which are accepted as a preparation of choice for emergency contraception, is USP and Lancy method, which is completed within 72 hours of coitus, which is the method USP and Lancy method. The copper devices will give the should be inserted within 5 days of unprotected coitus intercourse. So which is just within the 5 days. Which is a drug of choice for the emergency contraceptive? The mini pill, progesterone only pill, hormonal pill. It is a choice of like drug of choice for the emergency contraceptives is levonorgestrel 1.5 mg, a single dose within the 72 hours of unprotected sexual intercourse. Which is the best method of choice for newly married couple? Oral contraceptive pills is a best choice for the newly married couples. If in case 2 pills are missed, what is the woman supposed to do? The female has to stop the pack of OCP, continue with the barrier method for the rest of the cycle, check her pregnancy. If she is not conceived, the next month she can continue the OCPs. Hormonal includes the mini pill. Mini pill is also known as progesterone only pill. Injectables, we have NET-EN, non-testosterone enantate. Subdermal implants, we have Norplant and Norplant R2, which we have dealt in detail. So I hope the classification and the Details of each of this is very clear, guys. Oral pills, five headings: combined pill, progesterone only pill, post coital pill, once a month pill, male pill or gossipol. Under depot formulations, injectables. Under injectables, what all did we see? DMPA, NetEN. Combined, we have cyclophem, cycloprovera, mesigna. Subdermal implants, Norplant R2. We also studied about implanon, non-planon. All of these we don't want. For UG level, remember Norplant and Norplant R2 and vaginal rings. So the hormonal methods of contraception is completed. In the next video, we'll be dealing about the post conceptional methods and few remaining topics of this chapter, and we will wind up with this. Thank you. If you like my video, hit the like button and subscribe.